Daily Vite with Iron is a multivitamin and iron product that is used to treat or prevent vitamin deficiency due to poor diet, certain illnesses, or during pregnancy. Vitamins and iron are important for the body and help keep you in good health. It is recommended to take 1 tablet daily with a meal to get the most benefit from the medication. When taking Daily Vite with Iron, it's best to take it by mouth, usually once daily or as directed by your doctor. It's important to follow all the directions on the product package and not to exceed the recommended dosage. If you have any questions, it's best to ask your doctor or pharmacist for advice. This medication is most effective when taken on an empty stomach, about 1 hour before or 2 hours after meals. Be sure to take it with a full glass of water, unless directed otherwise by your doctor. If you experience stomach upset, you can take this medication with food. It's important to avoid antacids, dairy products, tea, or coffee within 2 hours before or after taking this medication, as they may decrease its effectiveness. Also, refrain from lying down for at least 10 minutes after taking the tablets or capsules. If you have any questions about your particular brand, be sure to consult your doctor or pharmacist for details. If you are taking the delayed release form or extended release capsules, it's important to swallow them whole and not to crush or chew them. Doing so can release all of the drug at once, which increases the risk of side effects and decreases absorption. It's also important not to split extended release tablets unless they have a score line and your doctor or pharmacist tells you to do so. Swallow the whole or split tablet without crushing or chewing. To get the most benefit from this medication, it's important to take it regularly at the same time each day. If you experience constipation, diarrhea, or an upset stomach, these effects are usually temporary and may go away as your body adjusts to this medication. If these effects persist or worsen, contact your doctor or pharmacist. Iron may cause your stools to turn black, which is not harmful. Remember that your doctor has prescribed this medication because they have judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. A very serious allergic reaction to this drug is rare. However, seek medical help right away if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects. If you notice other effects not listed above, contact your doctor or pharmacist. If you are in the US, you may report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you may report side effects to Health Canada at 1-866-234-2345. Accidental overdose of iron-containing products is a leading cause of fatal poisoning in children younger than 6 years. Keep this product out of reach of children. If overdose does occur, get medical help right away or call a poison control center. Before taking this product, make sure to inform your doctor or pharmacist about any allergies you may have to its ingredients. It's important to also discuss your medical history, including any iron overload disorder, alcohol use, liver problems, or stomach/intestinal problems. If your multivitamin contains folic acid, let your doctor know if you have a vitamin B12 deficiency before taking it. It's important to inform your doctor about all the products you use, including prescription drugs, non-prescription drugs, and herbal products, especially before having surgery. If you are pregnant or breastfeeding, consult your doctor before using this medication. It's important to be aware of potential drug interactions when taking Daily Vite with Iron. This product can decrease the absorption of other drugs such as bisphosphonates, levodopa, penicillamine, quinolone antibiotics, thyroid medications, and tetracycline antibiotics. It's best to separate your doses of these medications as far as possible from your doses of Daily Vite with Iron. If your multivitamin also contains folic acid, be sure to tell your doctor if you take certain anti-seizure drugs. Additionally, this medication may interfere with certain lab tests, so it's important to inform lab personnel and all your doctors if you use Daily Vite with Iron. If someone has taken too much Daily Vite with Iron and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the US, you can call your local poison control center at 1-800-222-1222. If you're in Canada, you can call a provincial poison control center. Symptoms of overdose may include stomach pain, nausea, vomiting, and diarrhea. Always be cautious of the recommended dosage to avoid any potential overdose. Remember, if your doctor has prescribed daily Vite with Iron, it's important not to share it with others. Also, make sure to keep all your medical and lab appointments. Some brands of daily Vite with Iron may also contain ingredients like docusate. If you have any questions about the ingredients in your brand, be sure to ask your doctor or pharmacist. It's important to note that this product is not a substitute for a proper diet. It's always best to get your vitamins and minerals from healthy foods. Be sure to maintain a well-balanced diet and follow any dietary guidelines as directed by your doctor. And remember to take daily Vite with Iron at the recommended daily dosage and at the optimal time for best results. If you are taking daily Vite with Iron on a prescribed schedule and accidentally miss a dose, take it as soon as you remember. However, if it is almost time for your next dose, it's best to just skip the missed dose and take your next dose at the regular time. It's important not to take a double dose to make up for the missed one. As for the best time to take this supplement, it is recommended to take it with a meal to help with absorption. The daily recommended dosage varies depending on age, gender, and specific health needs, so it's best to consult with a healthcare professional for personalized guidance. It's important to store daily Vite with Iron at room temperature, away from light and moisture, and not in the bathroom. Keep it out of reach of children and pets. When it's expired or no longer needed, make sure to properly discard the product according to the instructions from your pharmacist or local waste disposal company. Never flush it down the toilet or pour it into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.